Have you ever felt the room spin as you stood from your favorite recliner? Last week, Mrs. Johnson, 72, froze in her kitchen as the world tilted beneath her. Studies show 1 in 3 Americans over 65 experiences dizziness annually. That fear of falling can strip joy and independence. In this video, you'll discover simple, natural methods to stop the spin, no prescription required. But why is this spinning so dangerous? 1. Unseen risks of dizziness. Dizziness isn't just an annoying wobble. It can be downright dangerous. When your inner ear or blood pressure misfires, you lose balance in a split second, risking a hard fall onto cold kitchen floors or uneven pavements. In the short term, that fall might mean bruises, sprains, or a chipped tooth. Imagine tripping over your own feet while carrying a cup of coffee. Splash! And suddenly, you're nursing a sprained wrist and ruined shirt. Over the long haul, repeated episodes of dizziness lead to serious injuries like hip fractures, which land nearly 300,000 older Americans in the hospital each year. Beyond the physical toll, constant lightheadedness breeds anxiety. You may avoid weekend barbecues or family walks in the park, slowly shrinking your world. Let's clear up a quick definition. Dizziness is a feeling of lightheadedness or imbalance, while vertigo is the false sense that you or your surroundings are spinning. Both can trigger that heart-stopping moment when you think, "Am I about to fall?" That fear alone can sap your confidence and keep you glued to a chair. Because dizziness can steal independence and trigger a cascade of health problems, it's crucial to address it head-on. Fortunately, you can reverse these risks with natural steps. 2. Foundations of natural balance. Now that we understand how serious dizziness can be, let's explore natural steps to reclaim your balance and confidence. We'll break this down into 3 layers: foundation, optimization, and enhancement, so you can build a plan that fits your lifestyle and health needs. A. Foundation: hydration and nutrition. Staying well hydrated is the cornerstone of healthy blood pressure and circulation. Aim for 8 to 10 cups of water a day. Think a glass with each meal, one mid-morning, one mid-afternoon, and before bedtime. Dehydration causes blood volume to drop, making you lightheaded when you stand. Alongside water, include potassium-rich foods like bananas, sweet potatoes, and spinach. Potassium helps regulate fluid balance and nerve signals, reducing sudden drops in blood pressure. If you're on a diuretic or heart medication, check with your doctor before boosting fluids or potassium. Starting slowly, add 1 extra glass of water each day. Let your system adjust comfortably. B. Optimization: gentle balance exercises. Once hydration and nutrition are in place, it's time to retrain your inner ear and muscles. Try these exercises 3 times a day, ideally after drinking a small glass of water. Seated head turns. Sit upright, feet flat. Slowly turn your head to the right, hold for 5 seconds, then to the left. Repeat 10 times each side. Heel-to-toe walk. Along a hallway or beside a counter, place your right heel directly in front of your left toes, then step forward, reversing the pattern. Do 10 steps, rest, then repeat. Single leg stand. Stand behind a sturdy chair, holding the back for support. Lift 1 foot a few inches, balance for 10 seconds, then switch legs. Aim for 5 repetitions per side. These moves gradually challenge your balance without risking a fall. Always position yourself near a wall or sturdy chair until you feel steady. C. Enhancement: herbal support. For extra circulation boost and inner ear calm, consider gentle herbal remedies. 2 popular options are ginger tea. Brew fresh ginger slices in hot water for 5 minutes. Sip before meals to ease nausea and support blood flow. Limit to 2 cups daily, and if you notice heartburn or mouth irritation, reduce frequency. Ginkgo biloba. Often taken as 60 milligram capsules twice daily, ginkgo has been shown to improve circulation to the brain and inner ear. Start with a low dose for a week, then increase if well tolerated. Avoid if you're on blood thinners without consulting a physician. Always choose supplements that carry USP or NSF certification to ensure purity and quality. Keep a small journal. Note date, remedy, dose, and how you feel 30 minutes later. This simple record helps you spot what works best and avoid overdoing it. Throughout these 3 layers, remember the principle: apply sparingly, monitor, adjust. You don't need to tackle everything at once. Start with hydration and 1 exercise, then introduce an herbal remedy a week later if you feel ready. Pay attention to your body's signals. If an exercise makes you more dizzy, scale back or skip it for a day. If an herbal tea causes stomach upset, try halving the dose. If these aren't a perfect fit, there are other options to consider. 3. Alternatives and complementary supports. If the core interventions don't quite fit your lifestyle or health needs, you still have options. Let's look at both equivalent alternatives, methods that achieve the same balance-building goals, and additional supports that can give you a helpful boost. Equivalent alternatives. Vestibular physical therapy, or VPT, a specialized therapist guides you through tailored head and body movements to retrain your inner ear, much like our balance exercises but with expert supervision. VPT often delivers faster progress, though it may require clinic visits and insurance approvals. Magnesium supplementation. Magnesium helps relax blood vessels and support nerve function, similar to the way potassium-rich foods do. A typical dose is 200 to 400 milligrams once daily with food. If you suffer loose stools, lower your dose or switch to a chelated form for gentler absorption. Additional support. Acupressure wristbands. By applying steady pressure to the P6 Naguan point on your inner wrist, these bands can ease nausea and mild vertigo. They're inexpensive and drug-free, but relief may be modest. Aromatherapy with peppermint or lavender oil. Inhaling a few drops from a diffuser or a cotton ball can have a calming effect on your nervous system. While not a standalone solution, it pairs well with other interventions to reduce anxiety around dizziness. Selection criteria. Choosing the right alternative or support depends on cost and access. Clinic-based therapy can be pricier and time-consuming, whereas wristbands and essential oils are budget-friendly and over-the-counter. Health conditions. If you take blood thinners, avoid ginkgo biloba and high magnesium doses. If you have skin sensitivities, test essential oils on a patch of skin first. Personal preference. Some seniors enjoy hands-on therapy, while others prefer simple, at-home tools or supplements. Strengths and limitations. Vestibular therapy boasts strong clinical evidence, but demands more effort and scheduling. Wristbands are risk-free and easy, but only partially effective. Magnesium can improve circulation, yet digestive side effects may limit use. Aromatherapy calms the mind, yet won't directly retrain your balance. Before trying anything new, let's cover when to pause and seek professional guidance. Your safety always comes first. 4. Safety first. Contraindications and warnings. Before you embrace these natural approaches, it's vital to know when to pause and seek professional guidance. Even gentle methods can backfire if underlying health issues or medications aren't taken into account. First, certain health conditions require extra caution or medical clearance. heart disease, or uncontrolled high blood pressure. Rapid head movements and some supplements may strain your cardiovascular system. Diabetes. Fluctuating blood sugar can mimic or worsen dizziness. Ensure you monitor levels closely. Blood-thinning medications, for example, warfarin or aspirin. Herbs like ginkgo biloba can increase bleeding risk. Inner ear disorders, like Meniere's disease. These may need specialized care beyond home remedies. Next, watch for warning signs that demand immediate professional attention. Severe or persistent headache accompanying dizziness. Chest pain, shortness of breath, or irregular heartbeat. Sudden vision changes or slurred speech. Weakness or numbness on one side of the body. If you experience any of these, stop exercises and remedies at once and call your doctor or 911. When using herbal teas and supplements, adhere to safe dose limits. Ginger tea. No more than 2 8-ounce cups per day without doctor approval. Ginkgo biloba, maximum 120 milligrams per day, split into 2 doses. Magnesium. Typically 200 to 400 milligrams once daily, lower if you encounter loose stools. Always choose products with quality certifications like USP, NSF, or Consumer Lab to avoid contaminants and ensure accurate labeling. Store supplements in a cool, dry place and check expiration dates before use. Finally, pay attention to how your body responds. If a balance exercise triggers more intense dizziness, reduce the number of repetitions or switch to a seated version until you build strength. If an herbal dose causes stomach upset, cut the amount in half or switch to a capsule form. Keep a short safety log alongside your improvement diary. Note any adverse effects and the date they occurred. By recognizing contraindications, respecting warnings, and controlling quality, you build a safer foundation for your dizziness-busting journey. Next, we'll explore how to track your progress and know you're moving in the right direction. 5. Tracking your steady progress. Tracking your progress transforms trial and error into a clear roadmap, so you stay motivated and know when to tweak your plan. Let's divide your improvements into 2 categories: subjective feelings and objective measures. Then set realistic timeframes and encourage simple diary keeping. Subjective indicators. Less lightheadedness. You'll notice fewer moments of head in a spin when standing or turning your head. Increased confidence. You'll feel more comfortable getting up from chairs, walking to the mailbox, or dancing at family gatherings without that sinking fear. Objective measures. Balance milestones. Can you complete 10 heel-to-toe steps without wobbling or needing support? Exercise consistency. Did you perform your seated head turns and single leg stands 3 times today? Hydration goal. Did you hit your target of 8 to 10 glasses of water? Time frames. Early, 1 to 2 weeks. Expect a slight reduction in dizzy episodes, perhaps 1 less lightheaded moment each day. Medium, 3 to 4 weeks. You should feel noticeably steadier, able to walk a few extra steps without gripping the countertop. At each checkpoint, classify your status. Good to go. Keep the current routine. Needs tweaking. If you're not seeing signs, adjust one element. Maybe add another glass of water or swap in a magnesium supplement. Alert. If dizziness worsens, pause the exercises and consult your doctor. Diary suggestion. Keep a simple log. Date. Intervention used, e.g., 3 head turns, 1 cup ginger tea. Dizziness level, scale of 1 to 5. Notes. Any triggers or relief. A brief entry each evening takes less than a minute, yet reveals trends over time. Celebrate small wins.
Record a 0 day when you feel no dizziness to reinforce your progress. Now, before the conclusion, I want everyone to comment below your symptoms or the type of disease you are concerned about. I will reply to the comments or address them in the next video so everyone knows how to handle it. I will help you have good health to be happy with the people you love. Don't forget to like and share with your friends to know more about this important knowledge.
6. Solidifying stability. We began by recognizing how dizziness can upend daily life, from a fleeting wobble to serious falls, and why addressing it is crucial. Then we explored the foundation of hydration and nutrition, built upon gentle balance exercises, and enhanced our approach with targeted herbal support. We also reviewed alternatives like vestibular therapy and simple tools such as acupressure bands, before highlighting key contraindications and safety warnings. By tracking both how you feel and measurable balance milestones over weeks, you can adjust your routine confidently and stay on course. Remember, consistent monitoring and mindful adjustments are what turn small steps into lasting stability. Mantra: small steps, steady balance.